So welcome to Dental Sleep in 5, a new 5-minute series that will cover various important topics. Today is episode 1, and our first topic is My Appliance Didn't Work. What now? So by way of disclosure, I have no vested interests. I maintain a sleep disorders dentistry practice, conduct research, and provide educational programs. Our facility is accredited by the ADSM, and all our programs in our facility run to ADSM guidelines. So my appliance didn't work. What now? So you've calibrated your appliance optimally, you send it off for an efficacy study, and you still have unresolved apnea. Does that mean all is lost? Well, the answer is no. Physicians are quick to dismiss an oral appliance as ineffective. However, when an oral appliance falls short, we have adjunctive therapies available to us. Now, PAP is not the magic bullet physicians would like to have us believe. It works, but only a third of patients wear it all night long, about a third wear it part of the night and then take it off, and a third can't tolerate it at all. In contrast, oral appliances, 90% will wear their appliance long term. But sometimes an oral appliance needs some adjunctive help. Of course, you need to ensure that the appliance is optimally calibrated. Sometimes all that's needed is a little bit further advancement. And sometimes it takes months for the patient to be able to comfortably hold the appliance in place in that further advancement. So what's uncomfortable today will not necessarily be uncomfortable down the road. And so this becomes part of the journey. But once the appliance is optimally calibrated as per the patient's abilities, we have adjunctive therapies available to us. Yes, we don't have to give up. It's not the end of our road. So let's talk about them. Positional therapy. Here we see baseline versus mandibular advancement device results versus sleep position training results versus mandibular advancement devices and sleep position training together. And we see the best outcomes were obtained by combining these two therapies. Interestingly, when you're working with an appliance that allows the jaw to drop open, oftentimes patients don't have elastics placed. So the jaw is dropping open, contributing to the positional sleep apnea, and it could be eradicated simply by keeping that jaw closed. So adding elastics is what you want to consider in patients with specific appliances that allow vertical opening. Then of course there's adding an oral appliance to PAP therapy. Here we have baseline, then we have PAP results, and of course MED results falling short of the PAP results. But look at that, when you combine it, the PAP with an oral appliance, we get even superior results than they did with PAP alone. Then there's nasal patency. We know that poor nasal patency is associated with upper airway resistance and OSA. So it's important to evaluate nasal patency, and if the patient has an issue, perhaps recommending some over-the-counter devices that will help improve nasal breathing, or a referral to an ENT. Then there's weight. Okay, improvements in weight results in improvements in OSA severity. It's as simple as that, along with cardiometabolic comorbidities and quality of life. This is not a bad thing. Then there's exercise. Aerobic exercises have been found to demonstrate a reduction in disease severity and daytime sleepiness, as well as an increase in sleep efficiency. Interestingly, they ended up with these conclusions regardless of seeing any weight loss. So even in the absence of weight loss, exercise helps sleep and reduces OSA. Then there's myofunctional therapy. This meta-analysis here demonstrated a decrease in 50% for adults and 62% for children, demonstrating a real utility as an adjunctive measure to be used along with oral appliances. Then there's good sleep habits, things like temperature, lighting in the room, humidity, drinking alcohol before bed, taking caffeine, chocolate before bed, emotional excitement or arousal before sleep time, associated with symptoms of mild to moderate OSA. So by changing things up, you can in part correct the problem and make things better. Now, there's all sorts of lifestyle changes that could take place involving reduction in smoking, alcohol, use of central nervous system depressants, We've talked about exercise and a regular sleep time. This is important. All lead to better sleep that can help complement what we're doing with an oral appliance. So when you consider oral appliance outcomes, remember, for some an oral appliance is the full journey without any extra effort. For others, an oral appliance is the beginning of the journey. Either way, an oral appliance is part of the process. Thank you and sweet dreams.